Malawi rolled out its national Human Papillomavirus vaccination campaign in 2019, targeting 1.5 million girls aged 9 to 14 to prevent cervical cancer. But the COVID pandemic quickly disrupted the HPV vaccine drive with shifting medical priorities and social distancing. Medical aid group Doctors Without Borders, known by its French abbreviation MSF, this year launched a campaign to boost the low vaccine uptake by targeting girls at school.
It's easier to find this age group in schools than in a community. And at the school, we have the Minister of Education, which works hand in hand with the Minister of Health. And it's easier to explain or to advocate, to mobilize these children to get to understand what is an HPV and how can they prevent it, mostly in line of a vaccine.
MSF says since January, they vaccinated about 65,000 girls in 300 schools. MSF says Malawi has the world's second largest death rate from the disease, 7 times the global average, with thousands dying every year. Before getting vaccinated, girls are also taught about the disease.
Health education has helped us to prepare the girls for the vaccine and to make them decide what to do on their own. As such, a lot of girls between 9 and 14 years of age volunteered to get the jabs. Some were even asking us to vaccinate them before they get consent from their parents.
Malawi in 2020 destroyed 20,000 expired doses of COVID-19 vaccines because of low uptake over myths and misunderstandings. The HPV vaccine faced the same resistance as some parents refused consent.
Their fear was that they suspected that we were vaccinating their children to make them infertile. Some suspected that we want to vaccinate their children against COVID-19 and that we have just changed the appearance of COVID-19 doses.
Malawi health officials say meetings with village chiefs and parents helped debunk those myths, and the vaccination rate has soared in the MSF drive.
We wish this support can be normalized also, so that MSF can support us each and every time when we need to have this support on the HPV.
MSF says if there are no more disruptions, they'll keep up vaccinations to try to bring down Malawi's high death rate and maybe even one day stop cervical cancer. Lamek Masina for VOA News, Machinga District, Malawi.